Hi, this is Dr. David Green, CEO of the Arizona Pain Network. Today's topic are the top 5 ways to avoid surgery when you have sciatica. At any one point in time, about 1% of the U.S. population suffers from sciatica. It can be disabling, it goes usually down one leg or the other, and it feels like electrical sensation, really bad burning, it can be paresthesias and numbness. Basically, all in all, a very uncomfortable situation. It can affect your ability to concentrate, work, play with your kids, socialize, participate in recreational activities. It can, just really bring you down. So thankfully, about 80% of people get rid of sciatica pain within the first 6 weeks. And then within the first 6 months, another 10%, so 90% overall, can get rid of their sciatica pain and symptoms. So only about 5 to 10% of people who have sciatica will end up going on to need surgery. So the number one way to avoid surgery for sciatica are medications. Now, these medications are different. They're not all narcotics, okay? Now, narcotics can be given on a short-term basis, and they can be very effective for bringing the pain level down. And believe me, if you have medications for a few weeks with narcotics, it's not likely you're going to go on to become an addict. Okay. Now, number 2 are anti-inflammatories. Good old ibuprofen, naproxen, Celebrex, one of those, can be very helpful because what's happening with sciatica is that a nerve root, which let's say it's my finger, is being pinched by a herniated disc. Okay. And it's not that causes the pain, it's the inflammation that sparks up. So an anti-inflammatory can be very helpful. Tylenol can also be very helpful. All right. Now there's a medication called a Epidural dose pack, which is a hefty dose of prednisone. It's a prescription that you're given, and it lasts for 5 days. The prednisone starts with a high dose, and then it tapers off over the next few days, and it's a huge systemic boost of anti-inflammation. So you really only want to take it sparingly, meaning, take the whole 5 days, but you don't want to repeat a Epidural dose pack because it can have other issues because it's systemic. It can cause issues with the blood sugars, adrenal glands, so on and so forth. So really just want to take it once every few years or something like that. Another medication that can be prescribed effectively for pain relief is Neurontin. Neurontin is a medication that originally was prescribed for epilepsy and seizures, but they found that off-label it worked very well for modulating nerve pain. So it's very commonly prescribed, and there's also a new one called Lyrica that also can be very helpful as well. So when you get past the medications, the second way to avoid sciatica surgery is a combination of physical therapy and chiropractic treatment. All right, so you want to make sure that when you're getting the physical therapy that it doesn't make the pain worse. Okay, so it may be that you need to wait till I talk about number 3 with the injections before you have the physical therapy or the chiropractic manipulations, because they can make the situation worse before it gets better. But physical therapy and chiro, you have the electrical stimulation, the ultrasound, and other types of treatments as well that can bring the pain level down. All right, so that's number 2. Number 3 are epidural steroid injections. Now, these have been the gold standard for treating sciatica for decades, and they work very well. There's dozens of studies showing the effectiveness of epidural steroid injections. There's several different types of epidural steroid injections, but what's happening is you have this inflammation around the nerve root which causes the sciatica going down your leg. Well, if you bathe that pinched area with soothing anti-inflammatory steroid, it can relieve that pain, bring down the inflammation for weeks, maybe months. Now, they can be given as a series. You can have up to 3 over about a 6 to 8 week period, because if the first one does a little pain relief, you can give the second and third to augment that, and then you can wait a few months and get it repeated again. But you may not need to. What you're trying to do is you're trying to get the inflammation down and relieve that until the body disintegrates that piece of disc that has come out where it's not supposed to be. Okay? So the steroid doesn't fix the problem. It just masks the pain like a Band-Aid, and then while that piece of disc hopefully disintegrates. Okay? So that's number 3. Number 4 is a treatment called spinal decompression therapy. It's a computerized intermittent traction. It's often administered by chiropractic physicians. And what it does is it pulls the area where the disc compression is apart, and it can help oxygen and blood flow and nutrients flow into that area and help heal it somewhat and relieve the pain. Studies show that over 85% of individuals get dramatic relief when spinal decompression therapy is used. Okay. Now, the fifth treatment that works very well for sciatica is acupuncture. There are lots of studies showing how well acupuncture works for all kinds of things, whether it's arthritis, pain, or other systemic issues, but sciatica is one of them. It can help dramatically by decreasing the sciatica pain and helping people function better. So with those 5 treatments, over 90% of individuals are able to avoid the need for sciatica surgery. It used to be thought that bed rest was helpful for a week or so when you had sciatica or bad back pain. Not anymore. We know that that's actually more detrimental than just having 2 days of bed rest. Okay? There's only 2 times where sciatica surgery is really necessary. One is in a situation called cauda equina. That's a whole separate video, but that's a surgical emergency. And the second one is if you have a neurologic issue with muscle weakness that's getting worse over time. All right, so those are really the 2. If it's just pain, then that becomes more of an elective type of treatment. But if you have 6 to 8 weeks of conservative treatment, it's just not working, then surgery can be considered because it may just be that it wasn't meant to be non-operative. But thankfully, it's much less than 10% need that. Visit us online at ArizonaPainNetwork.com. There's a lot of educational information on the site. You can see our locations, a bit about the doctors, the insurances we take, and the phone number to call to seek treatment. Thank you for watching.